Thank you very much for the Anaphylaxis campaign and the kind invite to give a presentation at this annual conference. I'm always blessed to attend these meetings. So I've been given a very simple presentation, and this is about may contain. Okay, so I want to try and do this in the time I've been given because, as Claire alluded this morning, it's quite a complex issue. So just to give you an overview of what should be on the labelling, we've got two areas, mandatory, and that is the declaration of allergenic ingredients and processing aids, regardless of the level of inclusion. On a voluntary level, you can choose to provide information about the unintentional presence of allergens in foods, and this is called precautionary allergen labelling, or may contain. There's also free-from claims. So if you wish to proactively make a comment that you have managed allergens to a degree and it's free from, then you can use that to apply for your product. So precautionary allergen labelling, there isn't actually anything that is specific or defined in legislation that says you must provide warnings about allergens which are present as a result of cross-contamination. Okay, but within general food law, we have Article 14, which says food must not be unsafe, must not be injurious to health, and information provided to avoid an adverse health effect. So, communication of risk, you'll find that as a may contain type statement. And contamination can happen from anywhere, from the agricultural growing fields, from harvesting to storage, transport, manufacturing, and handling and packaging of foods. We do have guidance out there. For some time, we have the Food Standards Agency's guide on may contain surveys, may contain statements, and this was updated in 2013 by the Food Drink Europe Guide. Both guidance will tell you the hows and the whys, but it doesn't actually tell you at what point do you apply precautionary allergen labelling. So it's qualitative, but not quantitative. For non-pre-packed foods, we have Safer Food, Better Business. So this ingrains food safety as a concept and as a practice. And within this, we've strengthened the allergen management as part of general food hygiene. And just to let them know that actually, if you're controlling microbiological contamination, you're probably controlling the allergen contamination as well. But allergens goes a little bit further in that you know what is in what. So, defining risk. How are we doing this right now? So, as I said, Article 14 defines that food must not be unsafe or injurious to health, or that we should have the information provided to warn people about possible risk. But what does it mean? I think this is the biggest question we've been trying to answer for many years, and it precedes my time within the Food Standards Agency, so it's been going for some time. And what kind of health effect is unacceptable? And Claire talked about acceptable and tolerable risk, and we need to engage with our stakeholders to see what can we tolerate in order to move on from what we have at the moment. How we communicate this risk. We know there's a variety of precautionary allergen statements out there, but how's the best way to communicate the risk to the consumer? So, allergen cross-contamination is not as simple as it's always there in every single biscuit across every single batch. It can be intermittent, and the amounts can vary across the batch. So what we find is businesses will put labelling to err on the side of caution, and this could be rightly so. But what we have seen is proliferation of precautionary allergen warnings, and the FSA survey in 2014 showed that there was a diverse collection of wording. Some will try and be descriptive, may contain traces, may contain not suitable for, made on a line which handles, made on a site which handles, packed on a site which handles. What does it actually mean? So, all these different types of statements for the consumer, it leads to a subjective risk assessment, and perhaps it's leading to risk-taking behaviour. Does a different statement lead to a different type of risk to the individual? Probably not, because it's not being quantified consistently across the industry. May contain traces and may contain. What is a trace? My trace could be like a speck, but someone else's trace could be a spoonful. So again, it's not attributed to any level. And because of this confusion, consumers are starting to ignore or have ignored precautionary allergen labelling. So I mentioned the current guidance is qualitative, not quantitative. And what we need to do is move forward from this. And we need to get international agreement for the use of reference doses. At the moment, we don't have this. And this does lead to inconsistent approaches across different regulators in different countries and across the industry. We need to also agree on how much is too much. What is considered unsafe for the purpose of risk assessment and management on a public health level. Public health means that we need to protect the population as a whole, but not every single occasion, not every single individual on every single occasion. So there is a level of protection that we need to define and agree on. So the FSA, when we do our risk assessments, we try and build in some pragmatism in this, in that zero risk is hard to attain, and as the technology improves, it's a moving goal. And I won't take any kind of thunder from Barbara's talk, because that would really define that. But our decisions are made on several factors, such as the amount of allergen that's reported. What is reported as well? Is it the protein? Is it the total protein? Is it DNA? We're looking at portion sizes or consumption data. These shouldn't be confused. Portion size is what you should be eating according to the labelling. Consumption is actually what we eat in real life, which is a hell of a lot more. Ascertain the risk to consumer and calculate the likely dose. So using the information about how much protein is there, what is the dose on that eating occasion? And I turn towards clinical threshold data, looking at no observed adverse health effect levels and lowest observed adverse health effect levels and reference doses to make my decision. To complicate things, there's also two types of contamination, homogeneous or heterogeneous. So whether it's smooth as a powder form or whether it's heterogeneous, intermittent fragments of a nut. It's never simple. So moving on from this and trying to get the evidence to underpin the policy, we are doing work to harmonise the approaches to precautionary allergen labelling. And I will say that the FSA is not an island in this, in that we have to work across all stakeholders to move forward. And luckily enough, everyone wants to do that, which is not always the case in all areas of food policy. And this gives an overview, and I know I haven't captured everything, but this is what I'm involved in and what the FSA is involved in. The review of clinical data, and we've got some great studies there, Europreval, we've got some FSA studies, and we've also got meta-analysis through several papers, reviewing this as well at expert group level and at task group level on a European level with Commission and with the ILSI expert groups. Talking about acceptable risk, we need to get the patient groups there, we need to get our clinicians there, because ultimately they cover the people that we're trying to protect. And again, the same people, and we have, again, discussions on this, and we're trying to move forward on whether risk is possible to quantify and to accept. Methods. This, as Claire said, seems to be the more difficult one to overcome. The reference doses, and we've had some really brave people there. We've got great data, and I think we can move forward to agreeing a number, but making sure that the methods can measure to that number is another challenge that we need to move forward from. So quantifying risk, what is allergen-free? And again, this is going to be covered later on. And it's not an absolute zero, and it's usually defined by the allergen detection method that's been used in that case. So zero risk is actually really hard to attain, but I think we can define it. We've defined it for gluten-free, and it's not actually a zero. We have 20 parts per million. So this is an example where we've used a number here to protect on a population level, and I think we can do this for may contain. And we want to make sure that all our work will inform may contain statements and make sure that not making free from statements unnecessarily and appropriately. There are two different levels of risk. May contain will tell you about possible cross-contamination. The absence of a may contain does not equate to free from. Free from means that you've actively managed the allergen at all stages and it is absent in a finished product. So the public health approach, risk management, as I said, it has to be managed on a population level for public health bodies like ourselves. And what this means that we look at the eliciting dose 1, and this is where 1% of the population may react, but 99% of the population is protected. In other areas where data is not as robust, we may be able to get an EDO5, which means that we can protect 95% of the population with 5% possibly getting a reaction. However, what we are looking for is where we do see a reaction that we're not expecting a severe allergic reaction to occur. And this is a part of the discussions that we've been having recently in Brussels. Two excellent papers here, and I'll say that Steve Taylor is a bit of a god, and I'm slightly in awe of him. But these papers here just define that the level of work that's been done and the level of data that we have with regards to informing threshold doses. And you can see here that it's evidence-based, and with this, I think we can move on. So applying reference doses to manage allergens. I think we've got some really good data. We've got EDO1 for peanut, milk, egg, and hazelnut, which is great stuff. Looking at the allergy instance that we received in the Food Standards Agency in 2004, the culprits were sulfites, milk, cereals containing gluten, peanuts, soya, tree nuts. Well, I think with that we cover most of those four up there. So should we start here in order to give consistency to the consumer and consistency across the food industry? Allergen detection methods, they're really useful in telling us that we've got an allergen there, and they help inform and underpin our decisions with regards to allergen management protocols, risk communication and labelling decisions, and regulatory enforcement action. But we need to agree what defines an allergenic food, whether it's a DNA sequence or whether it's a specific protein. And but we have some problems in that with proteins which look very similar, there's the issue of cross-reactivity. So we need to do a little bit more work with regards to analysis. With cross-reactivity, I like to kind of draw your attention to ground cumin. And, oh my gosh, very late nights here. And we received some intel from overseas that we have some ground nuts possibly in cumin, and this is causing a particular problem. But looking at the investigation, there was no sign of nuts being handled along the manufacturing site. In fact, the company involved here, they got the seed direct from source and they ground it themselves. Where's the almond coming from? A lot of head scratching there, because our analysis told us we had almond there, and we had almond at a certain level. And I don't know, my heart sank when this came up on the British Bake Off and said, technical challenge, Mahalo. I'm like, oh my God, it's going to be the Delia effect. Mahalo's going to be everywhere. So when is almond not an alum? When it's a Mahalo. What's a Mahalo? Well, they're very closely related. So you've got Prunus dulcis, sweet almonds, and you've got Prunus Mahalo. So botanically, they're very close. They're cousins. very close cousins. And so what we saw was the allergen detection methods were picking up common proteins, which were found in both the almond and Mahalo. So we found the problem, and first time ever in the FSA's history, we had to rescind a allergy alert because what we found was actually Mahalo was the cause. It was used in the grinding facilities, and the great work of the local government chemist, the LGC, they found a method which was able to determine that actually we haven't got almond, we had Mahalo there. So going forward, I think we've got one more screen, we just need some more. But that just demonstrates the complexity of the issues here. So what do we need to do? Harmonised approaches to precautionary allergen labelling. Review whether they can detect allergens at a set allergen management threshold. So if we agree on a reference dose, can we measure for it? Can we measure what it's meant to be? So quality control materials or reference materials will help us do this to make sure that our almond is an almond and it's not that blimmin' Mahalo. Explore new technologies, and Claire mentioned orthogonal methods. So rather than just one, we can use several in order to pick up characteristics where one can't do everything. Performance criteria for allergen methods determine that they will do what they need to do, and it just lets us know that actually a method is fit for purpose. So next steps, what is unsafe? We need to agree what this is and whether we can use reference doses now. We've got the number, we've got the data, can we move on? Be consistent and define an approach to risk assessment and risk management. And this gives us the level playing field that we all are looking for. And we need to get agreement that, yes, this is the number that we're using, and this is how we're going to be managing it and enforcing it going forward. With precautionary allergen labelling statements, there's too many, and we need one single consistent piece of wording. Thank you very much.